today I'll tell you about the fresh versus the frozen embryo transfer cycles. A fresh embryo transfer cycle is when we give the injections to the patient for stimulation for the egg retrieval. In the same cycle we are doing the embryo transfer, that is fresh transfer cycle. When we freeze the embryos in the stimulated cycle and then later prepare the patient for the embryo transfer, that is the frozen embryo transfer cycle. But which is better? Fresh embryo transfer cycle is better or frozen embryo transfer cycle is better? So whether we are doing the fresh cycle or frozen embryo transfer cycle, they have their own indications. Frozen embryo transfer cycle is usually done when the patient has polycystic ovaries. So with the stimulation, the ovaries become big in size, the hormones increases, which affects the receptor of the endometrium. Second cases where it's done is in endometriosis patients, where already the estrogen hormone is high, to suppress the cycles, to bring down the hormonal milieu to the normal by suppression, and then we take them for the frozen embryo transfer cycle. The third case, when the endometrium is not good, so in that case also we freeze the embryos and then transfer them later. The fourth, when there is sometime fluid in the uterine cavity, in that case also we freeze the embryos and do the transfer later. It's not that every time we do the frozen embryo transfer cycle, there are certain cases where we can do the fresh embryo transfer cycle also. Cases where the number of embryos, they are less, patient is not ready for freezing. So in the lesser number of embryo cases, the hormones are not that high, so the endometrium receptivity is not altered to a great extent, where we can take the chance for the fresh embryo transfer cycle also, and we have seen good results with the fresh embryo transfer cycle as well. So this is the difference between the fresh embryo transfer cycle and the frozen embryo transfer cycle. It's the treating doctor who decides what is good for the patient, and based on that we take a call whether to go for fresh or frozen transfer cycle. Thank you so much.